So today we have Dr. Valerie McCray, who you may recognize from her DC March in July, and Lorraine, who is incredible, who I met on Twitter. And it was one of those things where you just follow each other, you love each other's posts, and then you offered to come on and talk, and I was like, yes, bring it, yes. So thank you so much for being here, both of you. Dr. McCray, we can start with you. As someone who works as a doctor in the mental health care field, I know in July you touched on that you see numbers higher than ever before as far as suicide ideation, depression, anxiety. I just read an article about the height of self-harm, things like that. And can you touch on that as a doctor, what you're seeing?
Well, of course, with COVID, we're seeing a spike with COVID because people are pretty isolated and kind of really fearful. So we're seeing a spike in where you can see it most is the request for medication. So there are more people on anti-anxiety, anti-depression medications than ever before right now. And I'm assuming we haven't gotten this latest. I don't have the latest statistics that with the situation in the Ukraine, I'm sure it's skyrocketing even more just because there's that fear of war, and just sort of all of that that's going with it. I know there was a spike with the whole Afghanistan thing with my military guys.
Mm-hmm.
When we pulled off out of Afghanistan, there was a spike in their mental health issues among the people that I was seeing. So between that and there's another layer here that when I'm not working with PTSD victims or people in the military or people in the communities, I also work in the prisons, which are our new mental health hospitals actually, and that's the shame of it. So we could talk about that a little bit as well.
Lorraine, I know you have a personal story, and it's totally up to you how in depth you want to go. This is, your show, all of you. So if you'd like to share a little bit about why the topic of mental health is important to you.
Yeah, well, as far as personally goes, I have a long history as far as first being diagnosed manic depressive bipolar when I was 17. And so I went through, I think, normal prescription and, therapy as far as trying to manage it. I got to, and this was like 25 years ago. So I got to a point where it was more harmful than it was beneficial. So I decided to kind of take it into my own hands as far as figuring out what worked best for me. And so from that, I was able to, honestly, exercise and nutrition has been a big part of me being able to manage that. So as far as on the spectrum of mental health goes, I feel very lucky that I seem to be on the lighter end, but I have several friends and family members who are on the more severe end. And my personal experience with them has been dealing with some of their episodes. And so whether it has been, threats of suicide, or whether it's been them getting off of medication and it being detrimental, and then trying to get them back on, I've found that everybody has their own limit, their own need. And when there are people who don't have access to whether it's medication or whether it's just therapy, talking and figuring out and gaining tools of how to manage their condition, they need support. And if they're not financially able to, then they just have to deal with it, and life is harder, is what I've seen. And so that's one of the reasons why I fully believe that Medicare for All is essential for mental health, because that way it's not an option. It's a guarantee. It's a guarantee that they're going to get the help that they need, whether it's medication, whether it's therapy, whether it's, certain tools that they use, like there's, DBT and whatever. So yeah, I definitely see the need for it. Yeah.
Absolutely. And you touch on the monetary aspect of it, and it's like, I know from someone who became disabled unexpectedly 2 years ago, it's like you go through such depression and anxiety, and you're like, okay, so I really feel like I need a therapist, but if I do that and I have even more charge card debt, then, and even with insurance I have, then I'm going to be even more depressed. So what do I do?
Right.
I mean, it's a hostage situation. You have to weigh which is best for me. And a lot of times you just say, I can't afford it. And you just try to cope other ways. Dr. McCray, you bring up a really great point that I want people to kind of understand, that there are two kind of like types of depression. There is clinical depression, but there is also depression situationally. Like we see, you're right, with the with wars, with COVID, you see just the amount of even defeatism, depression, anxiety. So can you touch more on that, the way that our society impacts our mental health?
Oh my goodness. They're interwoven. They're so interwoven as far as society. It's almost, mental health is also a public health issue as well. So whether or not it's dealing with pandemics, or whether or not it's dealing with just the stress of poverty, these things also bring on depression as well. And some people live in that space of chronic stress, which of course is going to bring on anxiety. And then and depression as well. The mind and the body is so interwoven that a lot of times, if you're depressed, you also have physical ailments as well, headaches, body aches. You just be physically ill as well, and vice versa. If you're physically ill for too long, if it's chronic, you're going to come to be depressed as well. So they're interwoven. But there is a difference between clinical depression and situational depression. That's not to say that the treatments are not similar, but a lot of times the clinical depression is usually in sort of that same category as bipolar depression. So it's more of a bipolar depression. And I think that's becoming more and more clear. Just because you're bipolar doesn't mean you have that manic state. Sometimes you can be bipolar but not have the highs of that. Yeah. So that can be interesting as well. So the clinical depression is probably an offshoot of the bipolar, except more with the without the mania, so to speak. It's interesting. So. Oh, it looks like we've got some more folks joining us.
Yes. Thank you for joining us, gentlemen. I'm glad you got through. So this is Gregor and Austin. They're the people behind Purpose First. And you both deal with cannabis and helping veterans with PTSD. So can you just kind of at first just kind of touch on what your organization does?
Yeah, of course. Thank you very much. So my name's Gregor. This is Austin right here. So we started Purpose First just over a year ago, although we've been planning it for over 3 years. We moved to San Diego, and we moved to San Diego specifically because of the veteran population down here. It is number one in all of America as far as populated cities for dense veteran population. Now, we wanted to make an impact in everyone's lives as soon as we could. So we got down here right after leaving the Bay Area. Now, I've been out of the Marine Corps for 5 years. Austin's been out of the Marine Corps for
6 years.
6 years. And we met as coworkers up in the Bay Area about 4 years ago. And from then on, we knew that we wanted to work together and we wanted to better our lives and better everyone's lives around us. And so we made the decision to build a business, to make an impact, to be the most purposeful business that we could, and to impact as many lives as we could. We've both struggled with mental health as veterans transitioning from active duty military to civilian life. And there isn't too many fast tracks to help you transition from one to the other. And Austin and myself, we use cannabis and have used cannabis to help us with our skills that we've learned to kind of de-escalate our own brains. I'm just speaking for myself, but it kind of helps me take a couple of steps back and reassess and be calm and really just be myself. I don't want to speak for Austin, but cannabis has helped me in my life for years. And I use as a medical patient, but I also use recreationally as well.
And so back to your main question, what is Purpose First? Purpose First, we started as a for-profit cannabis company, and we give free medical marijuana to veterans, a select amount. And then also we have a nonprofit that we do bi-weekly beach cleanups here in San Diego where we remove toxic pollution from entering the waterways and the ocean. And it's just been a super impactful thing for our community to cultivate community and also to give back to the earth and the humans on it at the same time.
Awesome. So that being said, Dr. McCray, have you had experience with patients who have, depression, anxiety, PTSD, who have used cannabis and found that it helps their symptoms?
You know what? I deal with a lot of PTSD, especially with the military. I think I've listened to close to 4,000 war stories. Interesting, because I do their evaluations. I diagnose the PTSD. Interesting that I live in a state, Indiana, where marijuana is not legal. And so a lot of my clients or a lot of the people, they talk about going up to Michigan, going wherever they can go. And sometimes I've suggested they move to those areas. But it is very helpful in ways that the other medications just are not, especially for sleep, to calm down enough to sleep, to sort of push the nightmares at bay a little bit. And just overall just anxiety and just being able to just get through your day. A lot of the veterans have found that marijuana has been very useful. But again, I'm in a state that it's illegal. So I can see the differences between the reports of the people that say that they go up to Michigan or go over to Colorado or whatever, just to get a break, just to get some sleep, just to get some rest. So I applaud these gentlemen because it's definitely a necessary thing for a lot of my PTSD veterans and across the board when you're dealing with trauma. I don't necessarily push it all over the place, because sometimes you need to be anxious to get your life moving. Anxiety is a good part of pushing you forward. So not in all situations, but definitely with the veterans and what they're dealing with as far as what PTSD is concerned. So I applaud you for starting that, and I hope you guys can come and help advocate for the veterans here in Indiana. That would be great.
Thank you, Dr. McCray. I appreciate that. Yeah, one of the things is the VA, when we get out, it's our number one source of healthcare. And it's beautiful because it is free, but at the same time, all they have to offer really is heavy opioids. And they give those things out like candy. whether it's for a migraine or for PTSD or what have you. And there's no real natural remedies. There's no real homeopathic alternatives. And we see a huge failure in that, and the fact that our veterans are just kind of going in a downward spiral with all these opioids. And it just makes them not be a human anymore. It makes them turn into a zombie, if you will. And I've seen hundreds of veterans personally, because we've had this veteran compassion program, switch from 10 to 12 opioids a day to a natural medicine to just cannabis. And it's really, really beautiful and eye-opening. So I appreciate you saying that, Doctor.
Yes.
That's amazing. Lorraine, do you have any experience?
I definitely have experience with cannabis, and can attest, as far as myself goes, that it has been one of the things that that has gotten me through the last 25 years, as far as my personal trauma and overcoming it. And then I live in North Carolina, where it is illegal, but there are numerous military bases. And so I come in contact with a lot of veterans, and that is the universal consensus, is that as far as helping them get through it, cannabis has been the most effective. So
Absolutely.
That's amazing to hear someone else say in support of a natural medication. You know, Austin and I, we've used recreationally and medically, and in all sorts of ways, it really does help. For myself, it helps me really just be myself, and then that can be used as a tool, or it could be used as a detriment.
Right.
And the way that I use it is in a positive way. And I take distance away from cannabis whenever I need it.
Right. Same.
Normally, I would consume every day. Sometimes I go without a day or a week without using cannabis, and that's just to exercise control and to take space away from it, to stay sober sometimes, and it really does help me stay clear-headed and productive.
Right.
And I wake up clear-headed, and I go to sleep clear-headed. And it's really just a blessing to be able to have access to cannabis. As you said, Dr. McCray, that, you know, not everybody has access, and it can be very difficult. You know, everyone has access to alcohol. Everyone has access to hardcore pain meds, and not everyone has access to natural medication that's grown naturally and that's sold at a consistent quality rate for something that's fair, you know.
I love, I'm sorry, go ahead.
Please.
Oh, I just want to say I love what you just said, as far as being able to step away from it as needed, because currently with my job, I am not able to, but I feel like because I had done it for so many years, you know, whatever healing properties it activated, or whatever benefits I was able to get from it, has carried me through when I'm not using it. And also, like you said, as far as the control factor, one of the things I've learned through my journey with mental health is balance. And so being able to balance that use, again, is just another way for me to feel in control and feel like, you know, I'm not dependent.
Right.
Awesome. I want to kind of digress a little bit onto the next topic. Dr. McCray, you spoke about talking to prisoners, and I have interviewed a gentleman from prison multiple times on my show. His name is Temujin Kensu.
Okay.
And he has been wrongly incarcerated for 35 years, been proven innocent, yet still sits there. And it's really incredible what they do, even with incredible health problems, like to the point where brain tumor, stomach cancer, like, I mean, hardcore problems. He literally cannot even have vitamins in his cell. He has to go outside and eat dandelion to get nutrients he feels he needs. That's how bad it is. So I'm touching on that. I'm kind of, curious what your experiences are to, with people in prison not being able to get what would essentially help them.
Prison food is non-nutrition. It's just no nutrition in it. It's all, there's no fresh salads, no fresh fruits, those sort of things. It's very rare that you see that. Plus the guys are women and men. They also order off a commissary, which is more ramen noodles, and sometimes they make pizzas out of pepperoni and all that stuff. These are things that are prepackaged. They're old. They're just not good for you, full of nitrates or whatever. So that can't be helping their mental health either if you're not rejuvenating with some food that's life-giving instead of this processed shelf life, forever shelf life food that they're ingesting. They can feed. The reason why mental health winds up being in the prison system, if you think about it, if someone's in a mental health hospital, you're talking about thousands of dollars a day, whereas they feed the inmates on $1.57 a day. They're able to do that, especially in areas like Georgia, some of the other areas where they grow their own food, where they have a chicken plant and that sort of thing. They've gotten it down to, less than $2 a day to feed an inmate. So of course, there's not going to be a big push to bring those people out of the prison system into the rest of the world, so to speak, or out with any type of paid mental health system. So they're stuck in a lot of ways. But with that being said, it's hard. Now you can usually, some of the prisons though, they will allow you to buy vitamins off of the commissary list. So that can be something usually that they can buy off the commissary list. But if they don't have the money to do that, that's a different story. But usually they can buy that along with soaps and all of that stuff. So, but it's very expensive and it's low quality. It's about profit with those situations. So, yeah, I'm sorry that he's stuck behind bars that long. We see a lot of that, and it's not any rhyme or reason to it. I see people with they come in when I'm checking them in for mental health, or my team or my staff is checking them in to see if they're mentally okay. It's not unusual for us to have one person that gets 8 months and the other one gets 20 years for the exact same charges. So there's no rhyme or reason to our whole system. And that in itself it's got some mental health components to it as well. So it's crazy. A lot of times that's where they do get consistent medications there in prisons, though. I will say that. But then once they get stabilized, there's no need for them to be there stuck in prison because of their mental health. But, again, Medicare for all, that's something we really need to look towards. One of the things that I wanted to talk about, I've seen the Medicare for all model, whereas they gradually, from kids to older adults, they gradually come this way to fill in. So you got the older adults starting with 55 on down. You're working your way down until everyone is covered. I've seen the models for how to get to Medicare for all. However, as Lorraine was talking about, most of the mental illnesses show up right around 17 years old, up to 25, 30 years old, especially for men, it's from 18, 17, like 16 and a half, up to 25 and a half. So we need to sort of start in the middle for mental health to make sure they're covered no matter what. The medical, their physical well-being, of course, is going to be fine, but the mental health part does not need that. We can't afford to do that sort of close-in thing because they're in the middle. They have no insurance at the exact time that mental health issues are showing up. So that needs to be covered across the board, 24/7. Every year in their life, mental health needs to be covered. That's not something we can wait for it to close in and fill in that gap for mental health. It's a critical time. between age 18 and 25. Very critical time.
Absolutely. Lorraine, I know with your job, have you noticed people, a difference in their depression, anxiety, and such from, exercise and what they consume?
Yeah. As far because I get to work for a company that's very involved in the community, and so there's a range of people who are in there, maybe once a month to people who are in there every day, and one of the things that is evident, especially the last 2 years, is definitely the anxiety, the fear, especially with with COVID. um that's a very personal, like that's your personal infection, and so everybody has their own kind of germophobia, as far as that goes, and how it's manifested. um and I don't blame them. But definitely, um, exercise. Some people use exercise, to get over that, and some people, in spite of exercise, still have such a high anxiety rate that you know e- even they need something beyond exercise. Beyond some of the lifestyle that they are living. So, yeah, whether or not they're able to get the extra care that they need, is really based on their financial ability.
Yes, you have to be a little bit well with depression before you can get to the gym in the first place, or get
Right.
to the exercise, because you just can't you can't get out of the bed, you can't get out there to do the exercise. So a lot of times we tell people, well, you're going to feel better if you would just exercise. Well, you're telling people that are so depressed that that's the last thing on their mind. If they could get to the gym, they will do great. It will improve, but they need sometimes a little help to even get there. So that would keep that in mind as well. So it's not just one thing. They need all of this together to sort of move them forward. Um, and yeah, and there was
And
something I
Dr.
forgot. Go ahead.
I'm so sorry. Go ahead.
No, I just it was something else, but I forgot anyway. So I'm glad.
I was curious about what you thought about the nutritional aspect, because with the impact and the effect that macro and micronutrients have on our body chemistry, brain chemistry, you know a, would that be a sufficient way to help to manage that, and with that being one avenue, still I know that that's a struggle as far as financially with some people, um, but uh, but as far as your experience, what have you seen nutritional or nutrition impacts? How does it impact people with their mental health?
Well, we know what nutrition, how it negatively affects. We know
Hmm.
that, for example, with people that don't get enough vitamin D or vitamin C, vitamin D, we know about the depression that's connected with people who live in climates where it's not enough sunshine, and
Right.
what they have to ingest to make sure that they balance that out, whether it's the vitamin Ds and all of that stuff. So we know that they need that. Unfortunately, a lot of our food chain doesn't have the same vitamins it did years ago before
Right.
it was sort of tampered with along the way. So
Yeah.
you really have to ingest a lot of good food to do that, to get what you need. So vitamins are very, very important.
Mhm.
Um, but I think just keeping the toxins out of your system it's a huge thing.
Right.
Um, and then just fasting and not eating at all for a little while helps
Right.
reset your clock as well, if you can do that.
I've been doing that and advocating for that a little bit more as well since I've started researching it.
You would be surprised with just taking a day or half a day and just making sure your system gets completely empty, what it does for body aches and mental wellness and all that stuff, just to get a restart. it helps a lot. It helps me a lot. I can only talk in those realms, but it does help me a lot. So there's so many avenues to mental health and fixing mental health, that the mind-body connection has to be considered, but we also have to consider the socioeconomic stuff too. And for those of you on the panel that don't know, I have ran for office a few times. Most recently I ran for U.S. Senate. We got bumped off the ballot. I got bumped off the ballot just a couple of weeks ago. So I have my own mental health issues about that. But we're going to keep continuing, because I think that you can't deal with these trauma situations over and over again, and these mental health situations over and over again without getting political. It sounds like a Purpose First is starting to be political about the things that they're doing as well. It's a political thing. We have to get connected. We have to get connected. Now, I will say this: the only group that among my clients, the only group that has done better during COVID has been my military guys. And it's mainly because now the rest of the world is doing the way they were doing, which is staying at home, staying away from people, distancing, social distancing. They were doing that anyway. So then now the world looks more like them, since they're having to do the same things as well. So the changes in COVID didn't affect them as much as it did the regular population, because they don't like to be around people anyway, and being around crowds, being in Walmart, any of that stuff is just something they couldn't handle anyway. So the COVID thing, they're like, hey, this is like another day for us. So with that population, that was one population I didn't see get worse because of COVID by itself. Yeah.
Right.
So.
Absolutely. And I had a doctor on my panel last night who said they're in Chicago area. They literally give out prescriptions for fruits and vegetables.
Oh,
literally.
wow.
Because they're in food deserts and they don't have the money to go to stores and buy fruits and vegetables. They have prescriptions. This is bananas to me. I've never heard that. To the Purpose First duo, do you guys find that the veterans who you work with, that if they do have a certain kind of diet or meditation or things like that along with the cannabis, that it is even more effective?
I definitely think so. I think what you put in your body is a reflection of how you're going to feel, how you're going to act. If you're eating a lot of processed man-made stuff, probably not going to feel that good. If you're eating a lot of natural stuff that comes from the earth, probably going to feel pretty decent. So I think not even trying to get into the weeds or advancing that, just being simple. Man-made stuff usually isn't that good for us. All these opioids, all this stuff that we're advocating against, kind of goes along with food. I mean, natural, simple, whole foods is usually really, really, really good for us. I haven't seen too many bad things from people eating a bunch of fruit, carrots, like a bunch of healthy food. So you see a bunch of people that eat fast food or processed stuff or whatever, it tends to not lean good. And I feel like how your physical body is a lot of correlation of how your mental health is as well.
And what's interesting about that is that we have a lot of food deserts in the African American communities, and the crime rate or the murder rate is really high. And then some of these things, and even just the environment and the lead in the water and in the pipes and those sort of things, all these things have to be considered when you think about the mental health of someone who's either been shot or been shot at or shooting at someone. There's a lot more into that. These kids aren't born just off the chain. There's a lot that they're not getting nutritionally, that they're not getting, and there's some bad stuff they're getting in the water, in the food. But it's not balanced. And so we've got so many things that it's not just these kids are in gangs or this and don't have dads or whatever. A lot of it, it's a lot of things coming together And then they don't have mental health help either.
On top of that.
So to be able to get and screen each child for mental health issues, especially for PTSD, because a lot of these kids look like ADHD kids, but when in actuality, they're stressed out kids. And it shows up as, as misbehavior or ADHD or not being able to sit still, or it doesn't look like an adult's PTSD. It looks totally different. It looks more hyper and that sort of thing. So there's a lot. And if we had mental health treatment for in at least some sort of assessment tool, even in the schools, so we can catch it early, and there's no stigma attached and no bill to pay for it attached to it, that would be great.
Absolutely. To Gregor and Austin, something we do hear about a lot is, well, the VA is free. They have great care. But, and trigger warning for those watching, there was a gentleman, I would say a year or so ago, who actually committed suicide while he was sitting on the waiting list of the VA clinic. And he had already been waiting over a year. So, and then for those who saw Bernard Sanders, one of his rallies, a veteran stood up and said, he was going to commit suicide because he had all these bills, even though, he's with the VA, and thankfully Bernie got that taken care of. But so we see these things, but, there is that presumption that, well, VA, has great health care. But we know that they are understaffed and there are caveats and everything like that. So in your experience, what have you found that, could be improved by the VA that would obviously be improved with national improved Medicare for all?
That's a great question. I'd like to just start by saying that, I only speak from my experience. Austin only speaks from his experience and the stories of our friends and fellow veterans that we know. We have been a part of nonprofits, veteran nonprofits that give free weed to veterans specifically. And so we do have a fair amount of stories about cannabis-related medicine in the lives of veterans and civilians, but specifically veterans. Now to revert back to what you asked, I believe that, implementing cannabis in your life is all subjective. It's all on a case-by-case basis. And if it helps you, that's amazing if it helps you. If not, we should always exercise control in a sober mindset, and then take space away from everything so that we can seek development within ourselves. Anytime that we gain improvement in ourselves, we seek self-improvement and we look in the mirror. And that's before going to get help, going to get diagnosed, and really just trying to help ourselves. Specifically to the VA, I think that it can be improved most with just taking time to care. Now that goes with any representative of the VA, any doctor in the VA. I notice that sometimes it's omitted, specifically listening and taking the time to care for the veterans and the people, dependents, what have you, that it's kind of forgotten to take the time to care, to truly listen to each story. They're all individual. They're all people. They're all different stories and different experiences. And you really have to listen and take the time to truly care. And that's really reflected in the service that we receive and that we know has been received. And it's very easy to tell when someone does care, and it shows.
So I believe with the VA, you say a great system. I have not seen that. My experiences have not been that way. All the veterans I've talked to, definitely not. I kind of compare it to the DMV. You look at the government organizations, a public organization, why do you have to wait hours in line? This is just like the VA. You're waiting for a long time to be seen. If you just broke your leg, or you just had a mental breakdown, or you just had this, whatever, you're going to be waiting for a long time to be seen. Yes, the staffing is a problem. So yeah, to bring it back to the VA, to a greater healthcare thing, staffing is a problem, and also paying their employees. You're going to get what you pay for.
Right.
These VA employees, they're amazing people, amazing human beings. But at the same time, you're getting low staff, you're getting low paid employees, so they're not going to care as much for their patients as you would a private healthcare system. You get a Kaiser and you're treated like the president. You go to the VA and you're a veteran, you're treated like a number. And it's really unfortunate. I think the two biggest things would be the amount of healthcare workers and how much they're paid. I think that would correlate into a better healthcare system for all.
I can say that my boyfriend says the same thing as far as his experience with the VA has not been very good. And in regards to mental health in particular, that's something that hasn't, not with him, but just in general, that's something that has only recently been almost accepted or advocated for mainstream. You know, back maybe 15 years ago, up to 15 years ago, it was almost taboo or shamed, or so I'm grateful that it is being advocated for now.
Yeah, it's amazing that it's free, but at the same time, if you're not getting seen for your problems and your problems just get worse, then it's almost like, what is the point? You know,
Right.
It's really difficult to see.
And I think it varies quite a bit from VA to VA.
Right.
You know, I get people from all over the state that come for their evaluations, and some of them have great experiences. Some of them have horrible experiences as far as the long waits and that sort of thing. And once you get into the system, it's a little bit easier. I think one of the problems the VA has is there's no rhyme or reason to who gets care and who doesn't. So some people who need to be cared for are not getting the information they need to go through all the red tape to get seen. And I just don't even know, with all the red tape, how someone who's severely depressed or who has severe PTSD, I don't know how they can navigate that system. It's a very difficult system to navigate through. I see people for disability that clearly are almost at 100% disability, but yet still they've never been seen by a physician, have never been seen by psychiatry or psychologists. So I see the other side of that too. I do the disability side. I was on the treatment side with the VA. I didn't like their model for interacting with patients, because I'm one that does like to listen and give time, especially to my Vietnam veterans that have waited a long time to be heard. And so I'm not trying to rush them or pack them in a 30-minute session. I'm just not about that. I'd rather take my time and make sure I know what they're about, but make sure I can hear them, or they can be heard. So I was with the VA for a very short while, and I walked away from it just because they wanted to put mental health on a medical model, which is you're in, you get the list of symptoms, you give them some medications, and they're out the door. And I didn't like that model at all. So I couldn't agree with that. That's totally different than the training I have as a psychologist. So I didn't stick with that very long at all. Yeah, it varies. I've heard some people who have wonderful stories from VA. They're not all bad, but then some people, the VAs just aren't close. They come from little small towns and rural areas, so they're having a hard time getting to the services they need. And that's the same way with maternity, the same way with women or clinics for women that are pregnant or need gynecological services or whatever. There's fewer and fewer places in some of these areas as well. So we've got a lot of different issues in our medical system. I think we can start resolving a lot of these if we go to a Medicare for all system where it's even across the board, as far as you don't have bills when you get home. Those bills will make you sick when you see how much you owe. worry about the losing your home and your property and all this. I have a friend in Canada that was in a really bad motorcycle accident. And he never got a single bill, not one single bill. He was unconscious for months. He was in the hospital for months, never got a single bill.
Mm.
We need to move it quickly to that, as quickly to that as possible. I can't say, Medicare for all is the one thing that's not having Medicare for all is actually fueling, I believe, a lot of the mental illnesses we have.
Yeah.
People have to worry about getting sick. You should have to worry about getting sick.
Absolutely.
Getting sick is sick enough. And everybody I know knows at least one person in their family, or they know at least one person that they're either afraid for
Mm-hmm.
or afraid of. We all have that person that we know that we're afraid for or afraid of because of their mental health status. So we're all touched by it, and we need help as far as making sure they have everything they need to get them help and get them moving and get them straight, so we can be straight. Mental illness affects not just that person, but it affects everybody who loves that person.
Yes.
And that's what's hard. It tears down everybody who's connected to that person.
Right.
Awesome point. So the next question is about disability. You mentioned mental health and disabled people. I wasn't blind at birth. Like, I literally lost my sight overnight 2 years ago. And, that physical disability thrust upon me, that trauma, also exacerbated the depression and anxiety I already had. So, I guess we can go around again. Dr. McCray, so what do you see in your patients with disabilities, like how much their mental health is impacted by their disability?
It's interesting that some people like yourself are just amazing through their disability. And if anything, it helps to fuel them to do something bigger, something more. It fuels them to do something bigger than themselves. And other people, they're just so overwhelmed by everything it takes to get through their day. So it just depends. And it doesn't help if they don't have services, readily available to help them through that. With disability, you have a lot of aloneness. A lot of people, I'm going to bring this up too, because we get a lot of people with hearing problems. That's a disability, but you've got a sight issue. Hearing is an issue as well. When people can't hear what's going on around them and everybody's laughing and joking and that sort of thing, those people are more prone to Alzheimer's going forward. They're more prone to dementia because they're not stimulating their brain in the same way. They can't hear, so they're not stimulating their brain in the same way. So they're alone. They can't get the jokes. People are laughing around. They're pretending like they hear when they really don't. They're isolated emotionally. So mental illness and hearing kind of go hand in hand in a lot of different ways. So we have to think about that as well. And so I can imagine what it's like to lose your sight, 85% of your sight overnight. That's a lot to adjust to. Has it stabilized at all?
Oh no, it's permanent. Like, I've had eye surgeries and stuff. Like,
So it's constantly getting worse. So we're talking about what we call a chronic adjustment disorder, where you're always having to worry about the next thing and the next thing, and then that leads to this. So it's a chronic sense of depression and anxiety. You're constantly adjusting to the next thing, and that's, I commend you for everything you do in the midst of that, because that's a lot.
Thank you so much. Yeah, and you're right. It does affect families too. Like, I'll be like to my husband, I can't plug in my phone charger, plug it in for me, because like I can't find, just the littlest things. So yeah, all of that just, God, it just weighs so heavy on your mind, and it really exacerbates any kind of depression or anxiety you might have. Lorraine, have you experienced anything like that, or any of your relatives or friends?
Yeah, so I had a friend who was paraplegic. He had an accident at 16 years old, broke his neck, and then from that point on, he was wheelchair bound. And one of the things that he struggled with was that similar, just trying to get through the next activity, just trying to, um, you know, trying to accomplish basic things. But then in addition to that was the guilt for if he did have to ask for help or if he did have to lean on any friends or family. So that adds not only to, I would assume, feeling of isolation, but then feeling of shame for having to need somebody else. And then with my mom, got she actually got died of brain cancer, but it was a long process. And so during that period when she did, and my mother was very independent, so she would get very frustrated and angry, and of course not only would that be toxic for her, but then it would be kind of traumatic for us as well. And so it is a ripple effect.
Most definitely.
Absolutely.
Most definitely. But one of the things that I have found with, say, the veterans with disabilities, those people that were injured in combat, those people that lost a limb and that sort of thing in combat, what I have found actually is that their depression and anxiety is not as bad as the people who stood next to them and almost got killed. Those people that stood next to them or watched someone else get killed or was in that situation where they almost got killed, they're stuck in that state of waiting for something else to happen.
Right.
That's why they need the weed to bring them down, because they're stuck in this sort of something else is going to happen at any moment. Whereas the people who actually got hit sometimes were able to cycle all the way through it. So they have other issues, but not necessarily that acute anxiety that something bad is going to happen, because with them, something bad did happen. Those that where nothing bad happened, but almost happened, they're stuck at this heightened sense of doom, like it's going to happen at any moment. So that's why they have difficulty at Walmart or anything else. They're waiting for this thing to happen. They, just a bag on the side of the road, anything like that. They think it's going to happen at any moment. They're waiting for it. And their body is stuck in that state of waiting or thinking something's going to happen right then and there. That's what I've seen a lot of those veterans like that. So sometimes the disability, when the people are injured, when they think they're going to be injured, it doesn't necessarily mean that those people are more mentally ill than the people who weren't injured. The people that weren't injured sometimes are worse off than the people that were injured. That's my experience with the ones that have been injured. Because are you sure you don't have depression? Are you sure you're not anxious? Are you sure? They're like, no, I'm fine. I just have to deal with all the pain and getting around, but I don't have that thing. So the people who almost got injured are in worse shape, that almost got injured, that are in worse shape. So the people that are left behind are in a lot of worse shape than the people who actually experience the events. And that goes for trauma at home. A lot of times people who watch the domestic violence, who are right there, they're worse off than the people who sometimes go through the actual domestic violence or whatever, just being in the vicinity. So we have to think about mental health broader than the person who's just the victim.
Right.
That's a really great point. Austin and Gregor, do you see that happening as well? And I've heard people call it like survivor's guilt, things like that. Do you see that with the veterans you work with?
Now, I would say that first and foremost, everyone's story is different. Everyone is individual. and the way that we process trauma is all case by case. Some of these folks that have been through trauma are still traumatized and live that every day. And their family can attest to that, and their friends as well. And I would just say that to fast track this, since it is an individual basis, I think that we all need to take a step back, realize that yes, maybe we weren't impacted physically by the IED or what have you, but we are around. And yes, we did go through trauma. And yes, my best friend or my brother, yes, is gone. But guess what? We are here today and we are lucky to be here. And first and foremost, we need to take our own health into our own hands, because you wake up and you seek that improvement yourself. You see the mirror and you should be thankful. Sometimes we forget and we're complacent with our lives and our freedoms in this body and in this world. And it's very important that we seek that from within. And some fundamentals of health, I feel like we really do forget in our healthcare system. For instance, yoga. This is a part of spiritual health, mental and physical. Yet many people in America don't do it. And this is a foundation of health. And it helps with being in touch with yourself, going through your traumas, and really finding peace within. And if we weren't so quick to diagnose potential diseases and or anxieties, I think that we can actually get through them a bit quicker and help with more holistic methods instead of diagnosing potential diseases with something that we don't really actually need to use or put in our bodies.
So I see a lot of survivor's guilt. The people that were around the trauma that had happened, they almost sometimes wish that it happened to them, because it's just so much to take on and to see, and they think so much of why was it them and not me, and why did I witness that, and it didn't happen to me. So yeah, survivor's guilt definitely is a big thing, especially with veterans, and that trauma just tends to compile, I feel like, sometimes. So yeah, that survivor's guilt is definitely there with quite a bit of veterans.
Yeah.
And do you both find that in talking to your veterans, do you think that, we've discussed what it is like once you are out of the military for the VA, but do you find that, some of the veterans you interact with have stated that it's hard to also get treatment when you're in active combat?
Yeah, so during active duty, it's almost looked down upon to get treatment, to be honest with you. You're looked at as a broken item if you can't go and train in the field or do your job. So it's a bad negative stigma toward even getting treatment, and you're almost shunned for it. So yeah, I definitely think that treatment in active duty is worse than treatment outside, because you're not as shunned for it. So it's an unfortunate thing, and sometimes a lot of these military members just go 130%, and they should they're hurting themselves even more, going out with more injuries, and in fact their brother and sister to the left or right of them is affected by that, because now they're not at their 100%. So yeah, it's unfortunate, and during active duty it's even worse. The healthcare is even worse.
Yeah, it is a lot worse from what I understand too, especially the women that there's what we call military sexual trauma as well. They can't seem to get help until after they get out because of the stigma, and it's just a mess. So we see a lot of that as well. Yeah, the stigma is really bad, but it's no different out in, well, there's a lot of stigma in the Black community about mental health. It's starting to ease up a little bit, and I'm not sure about the Latino community. They tend to will show up at a doctor's office with a physical ailment, physical pain. They're willing to talk about the physical pain, and then you talk to them more, and you realize that it's a mental health issue. But the stigma is there. But if we could have a situation where not only is it there, but that it's good to talk about, but also people can actually go get some help right away. Go talk to somebody, a social worker, somebody about what's going on with them and their family. But the stigma, it's a problem. That's one of the main reasons why I put my head in the ring. It's like, okay, I want to at least get mental health on the table. I want mental health to be an item to be prioritized in Washington. And I'm going to continue with that quest. But the main thing is just trying to get rid of the stigma attached to mental illness, because it's stopping us from doing a lot of things. And a lot of the stuff we could just do a lot better. And yes, it does need to have the components of the yogas and the meditation and those things too, because those things can actually work just as well, if not better, than some of the medications. A lot of the mindfulness training, which is part of that, is just mainly centering yourself in the right now, right here, not right now. And that's what yoga helps do as well, is to center yourself into what's now. And most people, if you just ask them, are you okay right now? Not with all these things you're worried about. Are you okay right now? And everybody, 99 times out of 100, they're okay right then, and they can calm down a little bit. So it's a matter of being in the now that we have to get better at. As Americans, we don't do that very often. We're always in the future, always in the past, never in the present. Yeah. So it's just a bad American habit that we have that keeps us totally anxious all the time, or depressed about the past, or anxious about the future. So it's an American habit, I think, that we have.
Great.
You actually stole my next question. I was going to ask about women and people of color, especially when, not just veterans, but how many of your patients do you find that come in not just because of, trigger warning, like sexual assault and things like that, but how many of them do you think, is it often that your patients say, I'm dealing with sexism at work and it's leading to depression, or I'm making less money and it's, or people are, whistling at me in the street and it makes me feel, unvaluable, or anything like that? Is that something that you see with some of your women patients?
With my female patients, I see a lot of self-esteem issues, a lot of self-degrading issues, a lot of putting themselves down. I see that with men too, but I see it more with women. I will say that this generation, this new group of people, young people, are not so body conscious like they were back in our day when Twiggy was the thing and being super thin. Now people are starting to acknowledge how beautiful big women are. So that's cool. The body image thing is less of a problem with this new group of folks coming up. But then there's still that perfection thing in the nails and the eyebrows and everything else. They all have to look like they are screen ready at all times. That's another issue. But at least weight isn't the issue right now as far as the focus. But, having the perfectly chilled eyebrows and the nails perfectly, there's a lot of stress there trying to look like what people do using those social media hasn't helped.
Right.
Because with the various methods people have for making their skin look better, or their eyes bigger, brighter, or whatever, they have all these things that they can do, Photoshop. And so young people looking at that, they're like, I want that body, I want that face, I want this, it's really affecting people a lot, especially the women, as far as feeling like they need to live up to that, to live up to the housewives of the famous or whatever. They need to live up to all of that stuff. So we're getting other pressure now with the media influences for them to look or be a certain way. So the impact of that is really something. In the African American community, of course, we're having issues. But the problem is only less than 4% of the psychologists are Black, even though
Wow.
a big percentage of the issues are coming from the poor communities, and a lot of the communities that are poor are Black or Latino communities. So, and there's fewer of us to take care of those issues.
Right.
So, of course, it's a cyclical thing there.
I would say that because I'm part Filipino and Native American, and so I have existed mainly in the community with people of color and Latinos and Black, and my experience of or the culture that we tend to adopt is the "I'm fine, everything's fine," because we have to truck through, we have to push through no matter what, because we don't have the luxury of being able to address those types of woes, um, and with being in an environment that is that is more poor, there is for myself is what I'm speaking. There is, you were talking about being catcalled or being assaulted sexually. We don't think that again, myself and the people that I interact with in my group, we just don't feel like we're going to be heard. So there's that that we're just gonna push it down because that's just what we have to do, versus being able to lift it up, address it, and then try to stop it on a global or local level.
Yeah. And then addressing, racism and mental health, and that, especially, the mental health issues among the Native American group is just, it's just mind-boggling.
Yeah.
How they've suffered over the generations. The suicide rates are higher. Believe it or not, the only group of people that are killed by police officers more than African American males are Native Americans. Are killed at a higher rate by police officers, slightly higher. I don't know what that's about, but it doesn't sound right. But definitely racism plays a role in that.
Right.
So the Native American community, we have to address some of that, all of that. There's a lot of apologizing that hasn't been done. There's a lot of fixing that hasn't been done, and it has to be done. For everybody to move forward. There's a lot that has to be addressed.
And it's a lot of just sweeping under the rug the epidemic. I guess it would be epidemics of sexual assault, even murder. Serial killers tend to gear towards people of color to target, but that isn't. It's just swept under the rug.
Yeah.
So it's not even acknowledged.
Yeah.
Yeah.
MMIW is hardly ever talked about. Missing and murdered Indigenous women. I mean, you're talking thousands every year.
Yes.
And that's their families affected too.
Yes.
No closure, no answers, no nothing. So that's also a tragedy in itself.
And feeling like prey, feeling that constant fear of walking down the street, or just that constant fight or flight, just that anxiety of, am I even safe?
Right. Yes.
Absolutely. Gregor and Austin, as far as your work with veterans, do you deal with women veterans? And if so, do you find that just, of course, overall, but do you find that there are differences in what they're suffering from?
Yes. In my interactions with female veterans, I have seen some of the similar traits and how they're treated, especially by other males, civilian males and veteran males. I'll just be 100% with you. It's got to be very, very difficult. And any time that I can support any female, veteran or civilian, and I do my best to help them stand up against the stigmas of sexism and or racism as well. You know, they're doubted consistently and not treated fairly at all. And this is in my experience. And I feel like that was while I was active duty and also as a veteran as well.
Yeah, I feel like women in particular are just preyed on by men, and it's really unfortunate, especially because obviously biologically men are just physically a little bit bigger. So that just, I can only imagine that's really freaking scary. So I have so much empathy for women in society today. And of course, you're just talking about social media and how everyone wants to look perfect and this and that. And, you know, we all are walking around trying to look almost fake, if you will. And then that just allows men to like prey on them more. It's just, it's a scary thing. So I have a lot of empathy for women in society today.
I mean, as a woman who's been doing a show by herself for 5 years, whew, it took me a minute to ignore those comments and, you know, oh my God, like I'm talking about something serious. Why are you making those emojis and stuff like that? Like it's a lot. It's a whole other kind of pressure. Yeah, it's truly mind blowing, but now I'm just like, whatever. Like I feel bad for you if that's what you're concentrating on when I'm like talking about imperialism or something. But in any case, one of the things I definitely wanted to touch on was before losing my sight, I worked in healthcare for over a decade. And I noticed, you know, and so many of my comrades have the same exact experience. There was even judgment within the healthcare system. I would be like processing a claim or pre-authorization for something, you know, psychiatric or something, and you would have a nurse walk by and be like, oops, somebody's going in the padded room and stuff like that in healthcare. So I just kind of want to address that going around again. Dr. McCray, what would you say to people in healthcare who, you know, may not understand the severity of such a thing and also why that's not funny?
Well, I think that you have to, when you're in healthcare, when you're constantly around people that are ill or are mentally ill, you have to make a concerted effort not to get jaded or not to be, you have to make a decision that, hey, no matter what, I'm not going to be part of this negative conversation. I'm not going to ignore the bells that are going off in the nursing home just because everybody else does. You have to make a concerted effort to care. And you also have to know when to disconnect when you find yourself being kind of crass or being negative or being pessimistic about everybody. I see a lot of that in prisons because they assume that everybody's lying. And I've seen people be really, really sick, close to dying because even the nurses were like, oh, he's just lying, or this person's just a fake, or whatever. I've watched people almost close to death because they had bad attitudes. And I think it just has to do with being immersed in that all the time. We have to have a system that takes care of the caregivers as well. And they have to be able to get a break. They have to be paid well enough where they can take a break before they start to become jaded and mean. And some people need to be taught not to become jaded and mean. And some people need to be caught on the rug about their behavior. A lot of it is fear too. A lot of times when people are afraid that might be them down the road, they can be some of the meanest people towards those people that are suffering. So a lot of times they need mental health treatment as well. So, hey, wait a minute, what is this about? Why are you being so mean to these folks? What is your fear connected to this person's illness? Who else do you know that has that illness? It's just interesting how these things are connected, but definitely they have to be taught to be, not everyone's good at being nice, but if they're overworked and underpaid, they're really not going to be nice. So you have to teach them to be nice no matter what, and call them on their, they might not even notice they're being rude because they've been doing it for so long. You know?
Do you think part of it might be a defense mechanism, or maybe even cognitive dissonance of, holy crap, people are going through so much pain and I'm doing what I can, but I can't take it away?
Yes. Listen, their fear, their frustration, so they take it out on the very patients that need them the most. It's really, really interesting. I tell people all the time, always go to a hospital with your patient, with your family. Somebody has to be there, because it's a situation where if somebody's not there that loves them, there's an attitude that can take over that situation, and your person might not be cared for, because people just can be mean. And I think it's because of their fear that could be them at any given point.
Absolutely. Lorraine?
I've got a friend who is a psychiatric nurse at a hospital, a psychiatric hospital in our state. And one of the things that she had said during a conversation where I was just extremely curious about what she did, she said that she had to fight kind of desensitizing herself because she would stop having empathy, like you said, Joy, as a defense mechanism, because she sees so much craziness, she said, and that basically she had to kind of take put up a wall and step back from it so that she wasn't feeling like she was traumatized from it.
Right. There's such thing as like vicarious trauma through other people's trauma, and then there's just that caretaker burnout that happens. You got to take care of yourself first. You got to pull back and take care of yourself, or you will become kind of mean and jaded. And here comes another one.
Yeah.
So yeah, it's important that the caretaker takes care of themselves.
Yeah. And I think also some of them go through experiences that are scary. And so they almost get angry and resentful towards those patients.
That's purposeful. What's your name? Somebody else is going to speak.
So I was going to say, it kind of brings it back to the 2 points I was making earlier from the VA translating to the bigger healthcare system. I think when staff is low staffed, it adds another layer of stress on these healthcare workers that is not needed. And then also being underpaid, you don't feel valued. So you carry around that jadedness, and that just gets spread onto the patients, and it's unfair. So I feel like with more staff, they're able to take more breaks, have more of a mental health break for themselves, and then also they're getting paid more. They feel more of a value. They feel like they belong to the hospital. So I think if we could just have more staff and better paid employees, I think it would result in better care for the individual.
Right.
Absolutely. So we could talk about this for like 5 more hours pretty much, but unfortunately it's time for the next panel. But I do want to just go around and give everyone a chance for last thoughts, and also where people can find you, your website, your Twitter, anything you want to plug. And just thank you all so much. This was amazing. We can go around the same way. Dr. McCray?
I'm easily reached by email at Valerie@drvaleriemccray.org. That's Valerie with the IE, Valerie. So it's Valerie@drvaleriemccray.org. You can email me and I'll get right back. I'll get back with you. That I handle my own email these days, so I will get back with you. And then we can talk from there if you need help or need guidance on getting somewhere. We are going to hit the 2024 election coming up for the Senate race. But I've got time to do that. So I've got time to handle the mental health part of it as well. So just give me a call. just email me. Y'all get back with you.
Awesome. Lorraine?
So I just want to say thank you to everyone for letting me be here with you. It's been an awesome conversation, and I love to learn, and I love to connect with other people who are trying to make a difference in this world. So thank you for that. Right now, you can reach me at just my Twitter, at Ba Intelligent, capital B-A Intelligent. And I'm just kind of doing that right now. But if anybody has any questions or anything that you think I can support you with as far as wellness and health, and just even someone to listen and to empathize and to empower, please feel free to reach out to me.
Awesome.
Oh, and
You
just real
just want
fast,
to-
I want to say, Dr. McCray, let me know how I can support you
Oh,
with your in 2024, honey.
hey, I've got your. I'll get your information from Joy. I will do that.
Right.
We just want to say thank you so much for having us. It's an honor to be here and to talk on mental health care for all. We want to help in any way possible. We want to make an impact, and we want to help people improve our healthcare system for all. And if you'd like to reach out to us, you can catch us at a beach cleanup. We do them the first Saturday of every month and the third Saturday of every month at 11 a.m. in San Diego Pacific Beach. You can reach us at purposefirstbc@gmail.com.
Yeah, I'm really, really grateful for the opportunity. Let's keep working to destigmatize mental health, because honestly, usually everybody is going through something, no matter if it's small or big. So I think, when you ask how someone's doing, they automatically say good. And that's usually not the case. So let's continue to work on making mental health more of a thing. I think with generational trauma, it's finally coming to light that this is something that we need to work on in society. And yeah, we're super grateful for the opportunity. We also have an Instagram that's Purpose First Beach Cleanups. And catch us in San Diego. We're also building a sustainable hemp company to replace things like plastic. So much love, and let's continue to work together.
I love that.
Nice. Awesome. I cannot thank the four of you enough. You are all amazing. Keep doing what you are doing. Dr. McCray, Lorraine, Gregor, Austin, please follow these amazing people. And this was amazing. This needed to be said, and I am so glad that you all joined us. So much love, and thank you so much.
I love you, Joy.
Anytime. I love you too, Joy. You're great. Thank you, guys. I love meeting you all.
Thank you so much.
Love y'all.
Love you. Have an awesome day.
Thank you.